Okay, so we've all, had that moment, right? Like that kind of tingling feeling, maybe a scratchy throat after, well, let's just say some iffy takeout.
Right.
But imagine that, but way worse, like exponentially worse. That's kind of where we're going today, diving deep into anaphylaxis.
And what people often miss is that it's not just like your average allergic reaction going into overdrive.
Yeah, this isn't just sneezing a bit more than usual.
Exactly. Anaphylaxis. That's a full-on system failure, a cascade of chaos happening inside you. Think about it. Your own immune system mistakes something harmless for a major threat.
Okay, so it's overreacting.
Big time. It launches this huge attack, but it's hitting multiple organs at once. And that can go downhill fast.
And we're talking serious medical journals here, stacks of them, to really get into how this all works. So let's break it down, this cascade.
At its core, you've got these tiny things, antibodies called immunoglobulin E, or IgE for short. They're like little guards, always on patrol, looking for specific allergens. But when they spot one, boom, it's alarm bells, releasing a flood of chemicals into your bloodstream.
Primarily, what histamine?
You got it. And that's when things get really, really bad really quickly. Your blood vessels, they dilate like crazy, your blood pressure plummets, tissue starts swelling up, and if that's not enough, your airways can constrict.
So you're struggling to breathe.
Exactly.
Yeah.
And in the most serious cases, that's how you get anaphylactic shock, which, well, without quick treatment, it can be fatal within minutes.
That's terrifying.
It really is.
Which is why understanding those triggers is so important. Most people know the usual suspects, peanuts, bee stings, shellfish.
Right.
But the stuff we dug into, talk about some unexpected culprits.
Oh, absolutely. Like, did you know a bite from a Lone Star tick can actually make you allergic to red meat?
Wait, seriously, like no more burgers.
You got it. It's called alpha-gal syndrome, and it's a prime example of just how strange these triggers can be.
So it's not as simple as just avoid peanuts and you're good then.
Not at all. And to make things even more complicated, anaphylaxis itself, well, it's not one size fits all either.
Yeah, our sources mention these things, endotypes and phenotypes. And honestly, those terms always mess me up.
I get it. Think of it this way. You've got two cars, both sputtering and stalling.
Okay.
Same symptoms, right? But the root cause under the hood
Mhm.
could be totally different. Endotypes and phenotypes are like figuring out what that root cause is specifically for anaphylaxis.
So understanding what's actually going wrong, not just the outward signs, so you know how to
Yeah.
fix it properly?
Yeah.
Exactly. Some reactions, they're driven by those IgE antibodies we talked about.
Right.
But others, they might involve different antibodies altogether, like IgG, for example, or even the complement system, which is like your body's rapid response team kicking in even if you've never seen the allergen before.
Wow. So you could have a first-time severe reaction out of nowhere, essentially. That's kind of scary.
It can be,
Okay.
and it shows why this goes way beyond just telling people to avoid certain foods. And how we treat it varies too.
Right, because knowing the root cause means you can target it directly, right?
Precisely. We're talking personalized medicine.
Okay.
So maybe it is the classic stuff, avoiding triggers, carrying an EpiPen. But for some, it's about retraining the immune system entirely, like with specific immunotherapy. It all depends on what we find.
So seeing an allergist, it's not just a suggestion, it's crucial. They're like the detectives of this whole thing. But before we jump into the how-to of handling anaphylaxis when it hits,
Okay.
there's the issue of who's most at risk in the first place, right? And our research turned up some surprising things there too.
It's not always who you'd expect. Age is definitely a factor. The very young and the elderly are more vulnerable. Pre-existing conditions too, like if you've got asthma, heart disease,
Mm.
those can increase your risk. But then it gets interesting.
Yeah, like what? Give us the curveball.
Well, get this. Something as simple as not taking your meds on schedule can up your risk for a severe reaction.
You're kidding. That's wild. Why is that?
So say you're doing allergy shots, right? That's immunotherapy, basically training your immune system. But if you're skipping appointments, not following the schedule,
It's like, what's the point then?
exactly, your body doesn't build up that tolerance it needs.
So you're basically showing up for the marathon without doing any of the training runs.
Exactly. It's about consistency. Keeping your body in that desensitized state so it's ready if and when it encounters the allergen.
Which I guess is a good segue into what happens when it does hit. Like, someone's having an anaphylactic reaction right now. What do you even do?
Okay, so huge point you bring up. When anaphylaxis hits, you gotta move, and fast. We've talked about how quickly things spiral, so recognizing the symptoms, knowing what to do, that can be the difference, literally.
Yeah, no kidding. And our research wasn't messing around. Every second counts here.
Absolutely. And one thing I want to clear up right away is antihistamines. People think allergies, they grab those. But against full-blown anaphylaxis, not enough. They might help with the itchy feeling, the hives, maybe.
But not that main danger zone.
Exactly. They won't touch that plummeting blood pressure, the airways closing up. That's where things get really scary.
Hey, what do you do? Like, what's the medical equivalent of hitting the big red button?
Epinephrine. Hands down, it's the thing for anaphylaxis. Every single source we looked at, they all said the same. Epinephrine first. And there's a reason why it works on so many levels. Constricts blood vessels, gets that pressure back up, relaxes the airways so you can breathe again. And it even helps with the swelling by reducing that capillary leakage we talked about.
So it's fighting the battle on multiple fronts, basically reversing that whole cascade.
Exactly. It's buying you time. And trust me, every second matters. That's why people carry those epinephrine auto-injectors, the EpiPens.
Right. Makes sense.
They're designed so anyone can use them, even without medical training. Straight into the thigh muscle, boom, epinephrine's in your system.
So step one, if you've got an EpiPen, then what?
Well, obviously, call 911, paramedics, AZADP. But while you're waiting, there's still things you can do. Positioning the person right is huge.
So.
Lay them flat, legs up. Helps get blood flowing back to the heart, uses gravity to your advantage.
Sure.
And if they're throwing up, turn on their side, prevents choking. Loosen any tight clothes, too. Make sure they're comfy as possible. Even just staying calm, reassuring them.
Yeah.
All that helps.
So much of this is about acting fast before it gets even worse. But what about when it does get worse? Like, even with the epinephrine, it's not enough. Our research mentioned this thing called refractory anaphylaxis, and that sounds terrifying.
Yeah, refractory anaphylaxis. Thankfully, it's rare, but it shows you just how complex this can get. Basically, the usual treatments. They don't fully cut it. You need the big guns, and usually that means the ICU.
So we're talking serious medical intervention at that point.
Absolutely. They might need continuous epinephrine through an IV just to keep their blood pressure up. Other meds, too, like glucagon, vasopressin, those help the heart and circulation. And in some cases, they might even use methylene blue.
Hold on, the dye, like the blue dye.
Yep, that's the one. Sounds crazy, but in these dire situations, it can be life-saving.
I have to admit, that's not a connection I'd ever make, blue dye, for a life-threatening allergic reaction. What's the science behind that?
Well, basically, it helps restore the tone in your blood vessels, which in turn helps bring the blood pressure back up. It's pretty amazing.
That's wild. But it also kind of drives home the point that you don't want to mess around with this stuff. The faster you can get help, the better your chances.
100%. Early intervention is key.
So we've gone from how anaphylaxis works on the inside to the immediate oh crap moment to the even scarier scenario where it's not letting up. But what happens after that ambulance ride? You get to the ER, hopefully things calm down. But then what? It can't just be hope for the best from there, right? It's definitely not a one and done situation, that's for sure.
Not at all. Once the immediate crisis is averted, the focus shifts. Big picture. You need to figure out how to prevent this from happening again.
Which starts with knowing what to avoid, right?
Exactly.
Oh.
Identifying your specific triggers, that's priority number one. And that usually involves some form of allergy testing, like a skin prick test or maybe a blood test.
So you know what to watch out for.
Exactly. But it's more than just knowing your enemy. It's about having a battle plan. And that's where the allergist comes in. They're the strategists here, helping you come up with a plan based on your triggers, your history, your life.
It's personal.
Absolutely. It's not one size fits all. It might mean figuring out how to avoid those triggers or making sure you've got your epinephrine on you at all times and you know how to use it. Maybe there are other medications or therapies that can help too. It all depends.
And I'm guessing as you learn more, that plan might change.
Oh, for sure. It's a dynamic thing. That's why regular checkups with your allergist are so important. They can keep tabs on how you're doing, tweak the plan as needed, and of course, let you know about any new treatments or research that might apply to your situation.
So basically, the more you know,
the better off you are. And a big part of that is being your own advocate. Don't be shy. Ask questions. Speak up if you're concerned. No one knows your body better than you.
well said. This has been a wild ride, honestly, from those tiny cells in your immune system all the way to life or death situations in the ER. But knowing there are ways to manage it, that's huge.
Absolutely. Anaphylaxis is serious, no doubt about it. But it's not a lost cause. With the right knowledge and being proactive, people can absolutely live full, active lives.
So to everyone listening, remember, this is just the start. Use this info, talk to your doctor, ask those questions, and take charge of your health. Because ultimately,
Those important everything you have.
And on that note, we'll wrap up this deep dive into the world of anaphylaxis. We hope you learned a thing or two, maybe even found some hope along the way. Until next time, stay curious.